Last week, the Republicans released the American Health Care Act, and we covered it here at Healthcare Triage. We also said the CBO really needed to release a report about it. And guess what? They did! That's the topic of this week's Healthcare Triage. The Congressional Budget Office is charged with producing independent analyses of the budgetary and economic issues to support congressional budget processes. It's a nonpartisan office, and its current director was appointed by the Republicans in Congress. Keith Hall is not generally considered a fan of the Affordable Care Act, and you can go read some glowing quotes about him by then Congressman and now Health and Human Services Secretary Tom Price in a number of media sources. Let's be frank. The CBO report doesn't look good for the AHCA. Let's divide its findings into a number of domains in order to understand them more fully. Insurance coverage. In 2018, just next year, the AHCA would result in 14 million more people being uninsured than under current law. Most of that would come from repealing the mandate. Some would choose not to buy insurance because they don't have to, healthy people, and some because they can't afford it. By 2020, the number of additional uninsured due to the AHCA would be 21 million. By 2026, it'll be 24 million. Most of the newly uninsured at that point will be due to changes in Medicaid, which I'll get to in a bit. The CBO agrees with me that the continuous coverage provisions might not work as planned. They think they will increase the number of people with insurance in 2018, but reduce the number in 2019 and beyond. In that first year, about 1 million people will buy insurance to enter the program, but each year after that, about 2 million people will not, because they'll be forced to pay a penalty when they do. Those will be healthier people, by the way. 14 million fewer getting insurance in the Medicaid program, 2 million fewer in the marketplaces, 7 million fewer in employer-based coverage, and 1 million fewer from other sources. Under current law, it's estimated that 28 million people might be uninsured in 2026. Under the AHCA, it would be 52 million people. Medicaid. Medicaid takes it on the chin. The CBO thinks that over the next decade, spending on the program would be reduced by about $880 billion. As we discussed last week, the per capita block grants go up each year by medical CPI plus 1%. The CBO agrees with me that this is likely to rise more slowly than actual medical spending in Medicaid. It estimates that CPIM will go up 3.7% each year on average over the next decade. Medicaid spending will go up 4.4% a year though. That leaves a lot of money for the states to make up. Either they do that or they start to cut. Enrollment is expected to drop pretty impressively by about 14 million people in 2026. Before 2020, almost all those dropped from Medicaid are not expansion eligible individuals, although the percentage from that population increases starting then through 2026. Health insurance market stability. If you listen to some politicians, they claim Obamacare is in a death spiral. Others, like me, think that's massively overstating the case. But let's listen to the CBO, and I'm quoting. Under the AHCA, the subsidies available, added to the grants in the Patient and State Stability Fund, would stabilize the market. But the CBO also says that the market is stable under current law. In essence, the AHCA doesn't change much in that respect. In 2018 and 2019, premiums would actually go up about 15 to 20%, because with the elimination of the mandate, healthy people will leave the market and leave the risk pool sicker and more expensive. In 2020, the Patient and State Stability Fund could be used to offset the cost of the very sick. Insurers could also start to offer plans of lower actuarial value, which would allow for premiums to be lower. Of course, that means higher out-of-pocket payments, but I'll get to that in a second. They also think healthier, younger people might return, lowering the price per beneficiary. These changes will combine to let premiums be about 10% lower in 2026 than under current law. Of course, these are averages. Older people are going to get crushed, and younger people will do better. More on that in a minute. Details on premiums and subsidies and the exchanges. Let's take a closer look here. In 2026, under current law, if we look at someone who makes $26,500 a year, they all pay about $1,700 in premiums for insurance regardless of income or age. That's cause while insurance costs $5,100 for a 21-year-old, $6,500 for a 40-year-old, and $15,300 for a 64-year-old, the subsidies are big for all of them. Under the AHCA, the cost of insurance itself is lower for the 21-year-old, slightly lower for the 40-year-old, but much higher for the 64-year-old. But the subsidies go way down, because they don't adjust for wealth. So the 21-year-old will pay $1,450, which is slightly less, but the 40-year-old pays $2,400, which is more, and the 64-year-old pays $14,600, which is more than half their income. And this new insurance has an actuarial value about 20% lower, meaning that they all have much higher out-of-pocket payments. If they make $68,200, then under current law, they get no subsidies. So their payments are the cost of insurance, $5,100 for a 20-year-old, $6,500 for a 40-year-old, and $15,300 for a 64-year-old. With the AHCA, though, they all do better, because they get something in subsidies when they got nothing under the ACA. They pay the exact same as the poorer person. The 21-year-old pays $1,450, the 40-year-old pays $2,400, and the 64-year-old pays $14,600. So, the more well-off see some premium savings, but slightly higher out-of-pocket payments, but the poor get, well, hammered, especially the older, poorer people. Effects in the federal budget. There are massive reductions in spending under the AHCA. Outlays for Medicaid go down $880 billion. The elimination of the Affordable Care Act subsidies in 2020 saves another $673 billion. Decreases in the employer-based health insurance market save another $70 billion, and repealing a tax credit to small employers for providing insurance saves $6 billion. But the new tax credits cost $361 billion. Getting rid of mandates and penalties costs the government another $210 billion. The patient and state stability funds cost $80 billion. And reinstating disproportionate hospital share payments costs $43 billion. And let's not forget the tax cuts. The AHCA contains about $600 billion of tax cuts, most of them to people at the very high end of the socioeconomic spectrum. Bottom line, spending goes down about $1.22 trillion. And revenue goes down about $883 billion. Therefore, the CBO projects that the federal deficit would be reduced by $337 billion over a decade. And since I get this question a lot, eliminating Planned Parenthood coverage saves overall about $156 million with an M over a decade. Technical reduced outlays are more, but that's reduced by increases in Medicaid spending, thousands more births, and associated care. And because this is the real world and there are trade-offs, lots of women will lose access to care in, and I'm quoting, areas without other healthcare clinics or medical practitioners who serve low-income populations. This is the real world, and there are trade-offs in this CBO report and in the actual bill. We have significant reductions in spending, although a lot of that goes to tax breaks, and in return, significant reductions in access. It's up to each individual to decide if it's worth it. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks, Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.